Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Coming up in our Your Health segment, the conditions that cause difficulty in breathing. We will find out how to prevent and treat these problems. That's ahead. First tonight, what taxpayers need to know about reporting their health insurance status when filing their taxes this year. Joining us is Rob Bader, Director of Tax Operations at the Baltimore Cash Campaign. Rob, thank you for being with us.
Thanks for having me.
Tomorrow is actually the first day that somebody can file their taxes.
Electronically file with the IRS, that's right.
And
yes.
The thing that's new this year is at least one line on the 1040 form about health care.
Correct. Actually, there's 3 lines on the 1040 form this year. And there's 3 parts to the Affordable Care Act that affect a tax return. The first is if you already have coverage through your employer, or you happen to pay for coverage on your own, then there's no real tax implication. But the next is for people who get coverage through the marketplace. They may be eligible for the premium tax credit if their income's between 100 and 400% of the federal poverty line, which, just to give you a rough number, if you're a single person, it would be $11,500 to $45,000. So it can be quite a significant amount of money.
Is that something separate from the subsidy that many people get?
That's the same thing. It's a subsidy. So that's called the premium tax credit. And basically, the government pays you that money so you will purchase health insurance.
Okay.
They also have, as part of that, the advanced premium tax credit, which pays you throughout the year, or pays your insurance company throughout the year. And that's great because you get coverage throughout the year. You don't have to expend your own money doing that. But on the other hand, when it comes tax time, if you miscalculated, you may have to pay some of that advanced premium tax credit back. Okay,
so the first part sounds fairly simple. Mm-hmm. Is there a box to check that says I have health care?
That's it.
Okay.
It's that simple. I mean, you just check a box and you're done. But if you got coverage through the marketplace, there's a little bit more to it.
And that sounds like it may be the area that might trip some people up.
That, and the third part, which is the individual shared responsibility payment. If you don't have coverage at all, then you may have to pay a payment. And calculating that's fairly complicated, but it could be fairly substantial as well.
The payment, I thought in the first year of this that the penalty for not having insurance was relatively small, maybe $95, $100, something like that.
It depends. It's like taxes generally are. It's complicated, and there's different tests. If you're a lower income family, it would just be $95 per person, up to $285 total.
Right.
If you're a higher income family, it could be up to 1% of your income.
And the mechanism that's supposed to encourage people to get health insurance is that penalty in future years is going to be much higher.
It is going to be higher.
Okay.
So this year it's 1% of your income is the maximum that you could be charged, and in 2 years it will be up to 2.5%.
Let me remind our viewers, if you have questions about how health insurance and health coverage is going to impact your taxes, you can give us a call. We'll have the number up on the screen. You could also tweet a question. Our Twitter address is @MPTNews. Let's step back for a second to what the Cash Campaign does. And you help people, generally low income, in preparing their taxes for free.
Correct. So I'm with the Baltimore Cash Campaign. There's also a sister organization called the Maryland Cash Campaign. So with the Baltimore Cash Campaign, we file free tax returns for people around the city whose income is under $53,000 a year. And it's a coalition of different groups who do this. It's about 5 sites are run by the Cash Campaign. The other 9 sites are run by city agencies, nonprofits, universities, a lot of different organizations around the city who do this.
How many returns does your group do in a year?
It depends on the year, but last year we did about 8,500 returns.
That's a lot of work.
It is a lot of work, yes, and it feels very substantial, but I should say there are about 75,000 people in the city of Baltimore who are eligible for the Earned Income Tax Credit, which means their income's under $53,000 a year, so there's a lot more work to do. but we do the best we can.
Let's take a phone call. Frederick County, this is Brady. Brady, thank you for calling. Go ahead.
Yes, I'd like to know if you have no income, will you still be required to pay the tax for having no health care? I'll take my answer off the air. Thank you.
Thank you for the call.
Thanks. So one thing I should say is if you don't have coverage, the first thing you should do is try to get Medicare and Medicaid, and that's free. Okay.
And actually, if you don't have income, you do have Medicaid, most likely.
Most likely, yes.
Right.
So, but if you don't have coverage and you have no income or very low income, there are things called I'm not saying it right, exemptions to the individual shared responsibility payment. And the first is having low income. If you're there's a lot of different income tests, but if you're low income, the other thing, if you're just missing a couple months of coverage for the year, you don't have to pay the payment. There are a lot of other issues, like if you're trying to get coverage and you were not able to do it, you can actually get a certificate from the Maryland Health Connection, and they will give you a certificate that says you tried. Basically, it's not this simple, but basically you tried and you were unable to get coverage. You were then not susceptible to having to pay the repayment. So, yeah.
The people most likely to get a nasty surprise here would be somebody who bought a plan through the exchange and had a subsidy, but it turns out that the subsidy was too high. In other words, the government gave them too much money to help buy health insurance. And maybe because their income turned out to be higher than they expected, they have to give some of that back.
Correct.
Does it work the other way? If your income turned out to be lower than expected?
You get money back, yes. So it goes both ways, yes.
Interesting. All right, Baltimore City, this is Joanne. Joanne, thanks for the call. Go ahead.
Yes, I'm calling because I'm a senior citizen, and when I was 65, I became eligible for Medicare, which takes out a premium every month for that portion, A's and B. But I also kept a supplement plan from my employer, which happens to be Blue Cross and Blue Shield. They also take a portion out of my checks before I receive them. So how does that figure into this new calculation? Plus, I also have deductibles for everything
that
I'm responsible for.
Joanne, we'll get you an answer on the air. Thanks for the call.
Okay.
Okay. So the first thing, to get the premium tax credit, you have to get coverage through the marketplace. So you have coverage through the employer, so you wouldn't get the premium tax credit. The one thing it does do, though, is since you do have coverage, you are not responsible for the individual shared responsibility payment.
Do people get some sort of form in the mail? If you bought a policy through the health exchange, do they mail you something, the equivalent of a W-2 or whatever?
That's a great point. Yeah. Yes, if you get it through the exchange, it's a 1095A form. So when you go to your tax preparer or when you're filing your own taxes, make sure you have that form with you. You should get those by January 31st or early February. And that will lay out how much you paid in premiums and how much, what the benchmark was for you. It'll also say if you got any of the advanced premium tax credit. It'll lay that all out for you and your tax preparer.
What do you figure that the impact is going to be on your preparers in terms of maybe the time or complexity involved in each return?
It's going to be extra work. So you should expect to spend more time with your tax preparer this year.
Don't wait until April the 14th.
Yeah, please don't do that. Yeah, so it should take some more time. But so it will take more time. You should, if you don't have the 1095A form because you don't have coverage through the marketplace, you should look to make sure you bring some kind of form or something from your insurance provider that says that you have coverage, and that can help your tax preparer as well.
I think I read that ultimately, and maybe not for a couple of years, that your W-2, your 1099, whatever you get, is going to indicate that you have coverage.
It will.
Through work.
It will.
But we're not there yet.
Well, it will indicate it on the W-2, but there's also two other forms that may come out this year, and they're voluntary forms. It's 1095B and 1095C. But basically, they're forms that come from either the health insurance company directly or from your employer. They're voluntary this year, so I don't know how many people will get them, but next year we should be looking to get those, and they'll have all the information the preparer will need, hopefully.
Let's take a call from Baltimore City. This is Lynn. Lynn, thank you for calling. Go ahead.
Hi, I'm self-employed, and I continued my previously carried health insurance that is not a part of the plan. Previously, based on income, I received deduction for that health insurance. Will that deduction continue, or have I made a mistake in not going through the Maryland Health Plan?
You can deduct it because you're self-employed. Is that what you're saying?
That's what I've done in the past, yes.
Right. Okay, we'll get you an answer. Lynn, thank you.
I don't do too many business returns, but I believe those continue. So.
Okay. Let's talk a little more about the folks that you serve and what income level or what other qualifications are necessary to take advantage of your services, and the important work that you do in terms of getting people the earned income credit that they might not otherwise get.
Okay, so the income guideline is $53,000 a year. So that's for an individual or family. It doesn't matter.
Flat rate.
Flat rate, $53,000 a year. So if your income is under $53,000, we can do your tax return for the most part. We're also part of what's called a VITA program. So it's a program. We are not part of the IRS, but it's a IRS program. So our volunteers are all certified as VITA volunteers. We all have to take training and what have you. And as part of that training, we are limited to certain types of returns that we can and cannot do. But for the most part, we can do almost all returns for people under $53,000 a year.
How much training do your preparers need to handle all this?
A lot. So our managers have at least a week every year that they have in training, and that's annually. We get that every year. And then the volunteers, we just finished training yesterday, and depending on the level of volunteer, but it could be 16 hours plus some webinars they have to watch.
And what do you want for people who are coming to see your preparers or really any tax preparer out there? What do you want them to know ahead of time? Just bring in the shoebox or maybe do a little organizing?
Actually, I appreciate people who actually do bring the shoebox in, because at least they have everything with them. So, but yeah, the biggest thing is just bring everything with you. At our sites, we are required as a VITA program to see your identification and your Social Security cards. People often forget those. And also Social Security cards for your dependents as well. But any documents, obviously W-2s or like the 1095A form is helpful. Any document, even if you question whether or not you need to bring it or not, just bring it is the best rule of thumb.
How often do you get somebody who's, for whatever reason, behind on their taxes?
Quite frequently.
I'm thinking in terms of years, not money, but either way.
Quite frequently, yeah. And we can do some back returns as well.
What's the best way for somebody who might be eligible for your services or the offerings in another county to get in touch?
The best way to statewide is to call 211. Just dial 211 on your phone, and you'll get first call for help 211 services, and they should be able to refer you to your local VITA or TCE, which is the AARP program that can do free returns.
Rob Bader is with the Baltimore Cash Campaign. Thanks for your time. Good luck in tax season.
Great. Thank you.
Appreciate it. And just ahead tonight, new treatments for COPD. We will be right back.
Tonight on MPT.
Antiques Roadshow is on a quest to find the treasures of the Empire State.
It is Tiffany. Oh my God. Oh, Kathy, that's fantastic.
Not so ugly after all, is it? Oh my God. That's really great news.
Wow. I'm impressed. Don't miss our discoveries from New York next time on Antiques Roadshow.
Tonight at 8 on MPT. Next time on Father Brown.
What I need is an exorcism.
A woman thinks her missing sister is haunting her house.
There are no such things as ghosts.
But when she disappears as well...
Mom, she's vanished.
There's no easy explanation.
The only other exit is by the windows.
You can't explain it, can you, Father?
Can Father Brown get to the bottom of this?
These numbers and letters. Thought it might give us a clue.
Father Brown. Tonight at 10 on MPT.
Saddle up for the next Maryland Farm and Harvest.
So what's the most challenging part of teaching somebody? Everybody learns differently.
Then learn more about buying and selling commodities. The Chicago Board of Trade is at the center of it all. All that and more on Maryland Farm and Harvest.
Tuesday night at 7 on MPT.
In this week's Your Health segment, Dr. Robert Reed, Assistant Professor of Medicine at the University of Maryland School of Medicine and transplant pulmonologist at the University of Maryland Medical Center. Doctor, thank you for being with us. We want to talk about COPD, which is chronic obstructive pulmonary disorder. What does all that mean?
So chronic obstructive pulmonary disease is the third leading cause of death in the United States. It's a devastating illness. It's the first two leading causes of death are cancer and heart disease, and those as well are linked to COPD. And it causes a significant amount of morbidity in the lives of those who are affected by it. There are over 15 million Americans who have it, and up to 15 million who are not diagnosed with it but have it. And to put that in context, there are a few over 300 million Americans, so somewhere between 5 and 10% of them are walking around with some degree of COPD.
What's the relationship between COPD and emphysema or chronic bronchitis?
That's a great question. COPD is the larger term, and chronic bronchitis and emphysema are subtypes of COPD. Chronic bronchitis is defined as having a cough that's productive for 3 months, 3 out of 2 consecutive years. Emphysema is really a diagnosis that is a pathological diagnosis. It's a dissolution and dissolving, if you will, of some of the tissue within the lung.
Who is affected by these?
Well, it's mostly smokers. 80% of people with COPD have a significant smoking history, and if you say, well, oh my gosh, I smoked last week, could I have COPD? It's really a lot of smoking required. We talk in terms of pack years. If you smoke a pack of cigarettes for a day for an entire year, that's a pack year, and most research studies require at least 10 pack years of smoking to consider the diagnosis of COPD likely. And you can either get that through smoking a pack a day for 10 years, or if you want to fast track it, you can do 2 packs a day for 5 years.
Not recommended.
Bad idea.
From a demographic standpoint, folks in your waiting room tend to be what age?
Well, most of the folks that I see are 40 years of age or older. It mostly hits people in their late 50s, 60s, and as you can imagine, it gets more and more prevalent as we get older. It is a disease that hits us more and more over time. As you ask about the demographic, it used to be considered that men develop COPD and women get asthma. That has really changed, and COPD is primarily a problem that we see amongst women now.
What changed it? What accounted for that?
Maybe Virginia Slims. I'm not entirely sure. It's I think that it's just the changing patterns of the medical profession, seeing that yes, this disease that we're seeing in women is indeed COPD. Women did begin smoking more and more during the suffrage movement, and there seem to be genetic predispositions, and women just seem to develop COPD with a lesser burden of smoke exposure.
Now, what about that 20%, I guess, that didn't have a smoking history? How did they get it?
Right. That is an interesting question. It is usually that they inhaled something that wasn't good for them, and it could be silica exposure, dust in the workplace. It could be that it was in this overlap with asthma that was inadequately controlled and progressed on to become COPD.
What's your thinking on marijuana smoke? Because it's a big political debate now. You know, the state has taken some steps towards decriminalization of it, even medical use of it. Does any smoke have the same impact?
If you inhale things that don't belong in your lung, it's going to do damage to the lung. I think that it's interesting. I can't say that marijuana smoking is good for you. It's not a good thing for the lungs in any way. In fact, you breathe in more deeply when you smoke it, and that can do damage. It's interesting to me that the tobacco companies are some of the greatest opponents to tobacco smoke or to marijuana legalization, and there may be some reasons to think that marijuana smoking may be in their disinterest. Medically, it's all a bad idea.
We'll talk about the treatment side. Let's get a phone call first. This is Joseph in King George, Virginia. Joseph, thanks for the call. Go ahead.
Yeah, I would like to know, like when I was in the Navy years ago, I was involved with burning a lot of paper, top secret paper and stuff like that in a generator, and smoke was coming out, a lot of black smoke. Could that cause COPD also?
Joseph, thank you, sir.
Well, Joseph, thanks for the question. That's a great question. I'm very honored to have the opportunity to take care of some veterans, and their service is greatly appreciated. Absolutely, inhaling things that don't belong in your lung is bad for your lung. It's true. There are now it's hard to say whether a little bit of smoke exposure would lead to COPD per se. It takes a pretty good period of time and a good amount of smoke for that kind of damage to occur. Now, there are other illnesses that can occur with lesser exposure, such as reactive airway disease.
Let's talk about the treatment side of this. What are the mainstays and what's on the horizon?
Well, there are a tremendous number of inhalers available for COPD. And when you boil it all down, really there are only 3 major classes of those inhalers. And 2 of those classes of inhalers work very similarly by dilating the airways. The 3rd class of inhaler is an inhaled corticosteroid that's intended to reduce the inflammation of the airways themselves. These are the same primary agents that we have for asthma, but some of the treatments are approached a little differently. In asthma, it would be a good idea to begin with an inhaled corticosteroid agent alone. In COPD, that would not be the best first agent. In an asthmatic, using a long-acting beta agonist, which is a type of an inhaler, would be a bad idea alone, whereas in COPD, it would be a good idea alone. So there are some subtle differences in the way that we juggle these inhalers. And then there are a variety of pills and other medications that we can use. And when to use them is a bit of a sophisticated question. I don't think I can answer it in 15 minutes.
Let's take another call. Baltimore County, this is Andy. Andy, thank you for calling. Go ahead.
Yes. Hi. I was just wondering, is this similar to silent ischemia? And what would the treatment be for silent ischemia?
Andy, thank you, sir.
Well, thanks for bringing that up. That's a great question. And in fact, there is a strong association between COPD and other illnesses. One of them is silent ischemia, coronary disease. And if you look at people who have known coronary disease, their underdiagnosed lung disease is in association with those folks. The same is true of people with COPD. They have more coronary disease than is truly appreciated. And it's frequently because the symptoms are quite similar. They both can present with shortness of breath. Heart problems can actually be accompanied by cough as well, which is one of the sentinel symptoms of COPD. And so there can be a lot of confusion between those two, and it really requires a conversation with a physician to try to tease out whether you have one condition or both.
You mentioned there's a lot of people out there who have it and it hasn't been diagnosed. What are they feeling? What are the symptoms that they need to get checked out?
Well, the symptoms of COPD occur in a spectrum. There are some people who have primarily cough, and that cough is similar to asthma frequently. It's oftentimes more sputum, more phlegm that they're bringing up. The other sentinel symptom of it is shortness of breath, and that can initially develop with exercise only and then progress to the point where they're short of breath even at rest. And it can be extraordinarily disabling, such that in the extreme cases, people are really confined to their own homes and unable to go outside of their own homes and live the kind of lives that they want to.
Primary care is a good starting point here?
Primary care is a great starting point here. You bet.
Very good. Dr. Robert Reed of the University of Maryland Medical Center, University of Maryland School of Medicine. Doctor, thank you for being with us.
Thanks for having me.
We appreciate it. Coming up Thursday at this time on Your Money and Business, how one local company is hoping to improve your health and a new business that is taking a bite out of the food industry. That's Thursday at 7:30. Remember to join us Wednesday at noon for live coverage of the inauguration of Governor Hogan. Hope you'll join us then. Now, for all of us here at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.